Welcome back. As eligibility for COVID-19 vaccinations in adults is expanding, multiple COVID-19 vaccines are beginning their trials in children.
And here to talk live about why vaccines are so important for younger age groups and the benefits it can have is Dr. Brian Curtis. Good morning, Dr. Curtis. Thanks for joining us.
Thank you.
Absolutely. Well, Dr. Curtis, you know, the Pfizer vaccine was recently authorized for people of the ages of 16 and older. Should teens get vaccinated? It's a big topic right now.
Yeah, and so 16 and 17-year-olds were cleared for the Pfizer vaccine only. The Moderna and the Johnson & Johnson is cleared for 18 and above. And so if you have the opportunity for a 16 and 17-year-old to go get immunized with the Pfizer vaccine, you should take advantage of that. And so we are having clinics here in Peoria. Unity Point and OSF are both having Pfizer clinics. And so really the opportunity to do it, because that is really a population that we're seeing a lot of positive COVID results coming through. We're loosening things up, sports are back, you know, people are starting to congregate a little bit more. And so this is a population that has it, and a lot of times they don't show signs or symptoms of it.
Well, that's one of the big things. I mean, earlier on in the pandemic, the talk was, you know, kids aren't getting really hit. So now to hear this shift, why is it so important that they are getting vaccinated?
Yeah, so, you know, if you have a child, what we know about COVID is how contagious it is. And so one person can infect 3 others, and so you can see it propagate fairly quickly. And so if you have a 16 or 17-year-old that's not symptomatic from COVID, that has COVID, they can infect a lot of people, other friends, and then their parents, and then the grandparents. And so it's just a stepwise thing. And so if you have the ability to vaccinate somebody to really prevent the disease and then prevent the spread of the disease, because the vaccines have been shown to prevent the disease and prevent you from spreading it to others. And that's a big component to it. And so by getting the vaccine, you're actually protecting yourself and other people around you.
And when it comes to the younger populations, are there any misconceptions or rumors that you would like to kind of dispel that is going around with, you know, younger people starting to get the vaccine?
Yeah, I think that COVID in a young population, while 99% of the time it's fine, but there's a multi-inflammatory response too that we're seeing in these kids, where they have renal failure, kidney failure. They just have responses where they get admitted to the hospital, they have heart problems and lung problems. And so while it's a very small population of children that have this, they are getting it. And so it is a risk of COVID. The other piece would be is it's not a big deal if I get COVID, and so I will do well. It's not a big deal. And the big deal about it is that you can infect others. And so, you know, a child may just have a sore throat for 3 or 4 hours or a half day, and then they'll feel fine, but they're contagious for 10 days after that. And so really that piece of it, and then all the other myths around the vaccines are totally untrue, and they're very well tolerated. And recently Pfizer released their data for 12-year-olds down to 12, which we're very excited about, because that's another population that carries a lot of COVID. And so we're waiting for the EUA to come through from the FDA to be able to actually expand vaccinations down to that age group.
When it comes to all of the misinformation, you know, different myths and things like that, that it has unfortunately been floating around on social media, on the internet and things like that. When it comes to talking to professionals like yourself or practitioners that have studied this and have gotten the information, what is the best way for families, parents to initiate those conversations that, you know, they may have some concerns?
Yeah, and so talking to your family, I mean, we know that for people to get vaccinated, it's important for them to know somebody that's been vaccinated. So the vaccine hesitancy gets better. So if I tell you I got vaccinated, you'll feel a little bit better about that than just reading it in the newspaper from the CDC. But it is an important conversation to have. And the best part of the conversation is having good data behind it. And so the CDC, the IDPH has a great website. Actually, Peoria County's website is very, very good. OSF Healthcare, Unity Point, all have great information to talking to kids and adults about this. But not having the conversation is the wrong way to go. And so really just broaching it, and then encouraging your family and friends to do it, because that's where you break down the hesitancy.
Yeah, Dr. Brian Curtis, a lot of big topics we talked about. Thank you so much for kind of breaking those down for us this morning.
Thanks.
Have a great day.
You too. And we will have all that information on our website, ciproud.com.